everyone, Dr. Kelvis here to discuss a few diabetes drugs, some of the new ones. Okay, so semaglutide is the generic name for a widely popular new drug, better known as Rybelsus or Ozempic, and I'm sure you've seen them all over the commercials. So it is a glucagon-like peptide 1, so GLP-1 analog that is FDA approved to assist in glycemic control in type 2 diabetes and for weight loss in those with morbid obesity. In the weight loss trial performed to evaluate semaglutide, almost 2,000 patients, 1,961 were enrolled in a double-blind trial. And this just means that neither the clinicians nor the patients knew if they were receiving the medication or placebo. So, and what the study found was that the mean change in body weight from baseline to week 68 was like a drop in 15% in the semaglutide group as compared with only 2% weight loss in the placebo, for an estimated weight loss difference of about 20%. And that's significant. The most common side effects, unfortunately, all drugs have side effects, were mild to moderate nausea and diarrhea, but that's pretty typical of a lot of diabetic drugs, especially drugs like metformin. But most patients found in the study that as they adjusted to the drug, these symptoms abated with time. Other common side effects include mild abdominal pain or constipation. Overall, though, the study concluded that semaglutide combined with consistent lifestyle interventions, of course, such as diet, exercise, resulted in clinically significant weight loss reduction. So semaglutide can be taken as either an injection or in a pre-filled pen, and the pen is dosed only once a week, which is great. Whereas the pill you have to take every day. So GLP-1 drugs like semaglutide, it acts to increase insulin secretion from the pancreas, and that's where insulin's made. Insulin is a hormone that allows the cells within the body to absorb glucose, and this fuels a cell's metabolism. If too much of the drug is taken, however, it can cause your blood sugar levels to drop, which is called hypoglycemia. And diabetic patients will recognize hypoglycemic symptoms such as feeling lightheaded, fatigued, dizzy. You could even pass out. Some studies show that semaglutide can actually enhance the growth of beta cells within the pancreas, which are the actual cells that synthesize and create insulin. In severe cases of diabetes or those with poorly controlled blood sugar, the beta cells within the pancreas eventually stop producing insulin altogether. And this is what causes patients to ultimately become insulin dependent. Semaglutide inhibits also the secretion of glucagon, which is another hormone, but it does the opposite of insulin. So while insulin allows cells to take in glucose, glucagon is what stimulates cells to release glucose into the bloodstream. So GLP-1 drugs, they also slow down digestion in the stomach, which of course reduces appetite and food intake, helps facilitate weight loss. Semaglutide specifically was developed in 2012 by a really big company called Novo Nordisk as a longer acting version of the original drug called liraglutide. And that brand name, that's better known as maybe Victoza. So liraglutide was an enormous success, but it came under some pretty severe scrutiny when clinicians started to see kind of a casual association with thyroid cancer and pancreatitis. But surveillance studies done later disproved all of these associations. And they found the casual association with pancreatitis to just be too inconsistent. So liraglutide has a half-life of 13 hours and is approved to treat type 2 diabetes, not type 1. So it treats type 2 diabetes and obesity.